From our team in Healthcare with Our Harm, we have a very diverse group. I think that's also something very relevant about this. We have people from Southeast Asia, from Africa, from Latin America, from Europe, from India. There has also been a lot of healthcare professionals coming to the INC, not only from our network, but also from other networks. So I think that's also something very relevant and important because finally environmental treaties are including health in them.
Broadly speaking, we have two general options that are on the table. The first option, a terrible option that will take us along the path of the climate crisis with no strong treaty provisions for plastics reduction, no consideration of the urgency of the plastics problem. And the second option, an option with provisions to address plastics pollution, but which isn't strong enough right now. We need a strong treaty that will address plastics along the entire life cycle. We need a treaty that takes into consideration no exemptions, in particular for the health sector, and we need a treaty that is protective of human health and the environment.
We're not alone in this as an organization, but we have other civil societies also to collaborate with, to amplify our messages. We're moving towards the end of this INC process, and it was frustrating at the beginning in the sense that the discussions were a lot circular and non-substantial. Now, after a few days, we see more of the real conversations happening. However, civil society, we've been kept out of these spaces. We haven't been allowed in the meetings to observe. And what we're asking for is that there is transparency, not just in the process of the negotiations, but also in the treaty itself, that there is transparency when it comes to plastic production.
It's important to integrate health in the different articles of the Global Plastic Treaty. As part of Latin American team, we have been working a lot with hospital, with health system, with health professionals. They have raised their voice asking for a global plastic treaty where the plastic product used in healthcare should not be an exemption. I think that it's going to encourage us to continue the work with our GGA members. They are leading the transformation in the region. They are showing to the world that the health sector is not only part of the problem, it's also part of the solution.
All of the work that we've been doing in the past month and then everything now is happening. It's incredible to be here to meet our colleagues in person. This makes everything our work even more stronger. Each one has been done great work in its regions. In addition to the work with Healthcare Without Harm, with WHO and IPEN, we have been also organized ourselves to contribute to the discussion with government, as civil society, and how we can join our efforts to even do much more. The Brazilian delegation has been very important in elevating the voice of health during the INC-5 discussions. Now we are going back home. I'm going back to Brazil and lots of work to do. We are just starting. We're very excited to continue this work.
The health sector is 10% of the global economy. We are ready and want to engage in the Global Plastics Treaty. The real battle will start once this instrument is ratified. It will not stop there. We in the Southeast Asia Office and Sustainability team will definitely engage with the partners and network that we already developed. There should be a whole society approach for this. We should not isolate it to the health sector, but we want to work with other sectors to implement a health-centric global plastics treaty.
We are excited to see all the things that we have worked hard for in the past months come into fruition. Working with member states, rallying them, making sure they send a health representative. We are thankful to the Philippine government for sending DOH as part of the Philippine delegation, bringing health professionals from all over Southeast Asia to the actual INC-5. We held a photo exhibit and people's campaign on the intersection of plastics and health. We displayed the top 15 here in Busan, and allies from all over the world gave their statements of support.
Coming to INC-5 was a very great experience. We tried hard. We are still continuing to work hard on it. Going back from Busan, I like to have a robust treaty which reduces the menace of plastic pollution that we all have. And specifically for the healthcare sector, like we have already been working to reduce the usage of plastics and will continue doing it irrespective of the outcomes of this treaty.
After INC, I believe that whatever happens with the treaty, we have created a lot of networking here, and NGOs that are working for an ambitious plastics treaty are stronger than ever. So even if the treaty is not what we want, I know that we're going to be able to make a change.